Dr. Leonora DNP, and welcome back to Vitals and Vibes, where we drop clinical gems and career wisdom to protect your license, your peace, and your purpose in healthcare. So today's episode hits a little bit deeper than usual because this week the world remembers tomorrow the legacy of Dr. Martin Luther King Jr. Now, we all know MLK's for his civil rights leadership, his speeches, and his sacrifices. But did y'all know that he once called healthcare the most inhumane form of injustice? Yep, he said that. And honestly, still in 2026, we still catching up to his vision. So today, let's talk a little bit about what it means for you as a nurse, a CNA, an NP, or a healthcare worker. MLK's dream was bigger than what we realize. Dr. King wasn't just talking about voting rights and marches all the time. He had a dream that included economic justice, education, and healthcare for all. So in 1966, he led efforts in Chicago that addressed poor housing, unemployment, and the lack of medical access. And that's really what public health is, y'all. He knew that racism lives not only in the streets, but it also lived in our hospitals, our clinics, and in healthcare policies. And we still seeing that today. Health equity isn't just a trend. It's been happening all the way back from the 60s. It's really a part of his dream, and that is what he believes. So let's talk a little bit about what health equity is. Health equity means every person, regardless of their zip code, their race, their income, their gender, or their background, has a fair and just opportunity to be as healthy as possible. And it's about removing those obstacles that we may have, like poverty, discrimination, and access to care that keep people from thriving. But why does this still matter in 2026? Because Black mothers, they are still dying at a higher rate during childbirth than any other race. Rural communities still lack consistent providers. Incarcerated patients still face unequal care and treatment sometimes. And then the language barriers still prevent quality treatment for those where English is not the first language. And nurses, we are on the front lines of this every single day. So really, if you call yourself a nurse, a healer, a caregiver, or you got a role in the fight for health equity, but you can't change everything. But what you can do is, wherever you are, whatever organization that you work for, speak up when you see those biases. So if you're working in that hospital and you see that people are treating this patient different than another patient, then you need to speak up about it and advocate for those interpreters. We have a lot of people that English is not their first language. So when you see that, advocate for interpreters so that we can understand what that patient needs. Fair treatment for all, and safe discharge plans. We talked about last week about joining professional organizations. So join those organizations that do the work, like NBNA, the Latino Nurses United, the National Rural Health Association, and whatever organization is fitting the mission, you need to join those organizations and vote with your values and support policies that center around health equity. So my advice is, this year, don't just post these MLK quotes this week and on the day and live the dream in your practice. Where you work at every single day, live that dream in your practice. So here's your Vitals and Vibes challenge for this week. All right, this week I want you to learn one statistic. Oh, that's a hard word to say. Statistic about health disparities. And I want you to post that. And then have one conversation about equity with your team, with your students, with your family, and commit to one change in how you deliver healthcare if you are a healthcare professional, or in your family. How do you change? How do you help your family members with their illnesses? How do you deliver that care? So wherever you are, have those conversations, and make sure that you tag Vitals and Vibes when you do. So like, comment, and subscribe for more Real Talk episodes that help you grow smarter, stronger, and more impactful in this nursing game. So next week, we're going to have a whole new topic. So until then, protect your peace, protect your purpose, and protect your license. This is Vitals and Vibes with Dr. Leonora DNP. See y'all next week.
Popping, but these bitches in my business coming out, you're choosing violence if you